My name's Nilo Azad, and I am a medical oncologist at Johns Hopkins. I have the pleasure of chairing a session on the treatment of unresectable colorectal metastasis and how we treat those different patients with local regional therapies. And I'm co-chairing that session with Dr. Laura Dawson, who is my colleague and good friend and really a leader in this space as well. And so the session, I think, is quite educational. And what we're really focusing on is going through the data that exists for different modalities. So when we think of local regional therapy, especially liver-directed local regional therapy, we really think of three different buckets, right? So we think of interventional radiology approaches, we think of radiation oncology-based approaches, and then we think of surgical approaches. So our speakers have really focused on the data that supports each of these modalities and what the limitations are of each modality and why you might choose one versus the other. And so in the interventional radiology space, of course, the conversation is really around the really strong data for ablation in different settings, as well as the use of TheraSpheres or SurSpheres, so radioembolization. And so I think these are patients that really we can target with these kinds of therapies, but we also have the potential to use radiation-based approaches, and so I really found that part of the session to be really interesting because it's not just where can we use radiation, but some of the technologies that have evolved in radiation, which is always a great area for me to refresh on or even learn about. And then I'm really excited about the final segment that we have in this session. And there's been increased data in the last couple of years, and especially an important trial that was reported to 2024 regarding liver transplantation in the setting of patients who have disease confined to the liver, but that is unresectable. And so we have a debate between basically a pro versus con of considering liver transplantation versus unresectable disease, but where should you really still be creative and be thinking about resection? And while it is a debate, I think you'll see it as a really collaborative session where both speakers really talked about where the person supporting liver transplant really spoke to why we might still consider resection. And then, of course, our Dr. Fong, who was the surgeon who had the con proposal, but did really speak to where liver transplant might really be effective. And I think this is really important because it's an area where patients are coming to us and asking the questions. And I think because the data is evolving, there really is a segment of patients that with both of these approaches, we can be thinking about long-term disease control, even the C word, cure. And so I hope that everybody finds that session to be as educational as I do. And of course, it's available on the ASCO GI website.